So I'm joined by Dr. Michael Barrett, astronaut and a space medicine expert who's been giving quite a few talks at the conference here. So Michael, there are a few things, in fact there's a lot of things that I'd love to talk to you about, but one of the things that, that really struck me yesterday was hearing you talk about risk. As someone who is really interested in patient safety,
right.
I wanted to ask you a little bit more about that, in particular with relation to simulation, which I know that you astronauts do an awful lot of. So tell us a little bit about that.
Well, interestingly, we're constrained to the simulation world just by nature of what we do. Unfortunately, we just can't go practice in space anytime that we want to. It's very difficult. So our best approximation of that is to do simulations on the ground. And that includes both the environmental simulations, like getting into a water tank to practice spacewalks, and the systems and team simulations we do, which would involve entire mission control teams working with a crew in a spacecraft simulator. I would say that's pretty much at the core of our training for mission readiness, both for the astronauts and the ground teams.
Okay, so you're using different modalities of simulation depending on what you are trying to achieve in those simulations,
right.
I guess.
Absolutely. Yeah. Unfortunately, we cannot recreate all of space to train in, so we do a patchwork of simulation training, and you put that together holistically to get to your flight readiness state, for instance. Yeah. So one day we may be training in a big water tank, training for spacewalks. Another day we may be in a virtual reality trainer using a robotic arm manipulator, and again interfacing with the mission control team. So it's again that composite that gives us that readiness.
So I'm guessing that for a 6-month mission on the International Space Station, you'd spend quite a few months beforehand actually doing simulations.
Absolutely.
Yeah.
And that's multinational. You know, we train in the countries of all the agencies who supply large modules to the station. So you may actually spend quite a bit of time in a Russian simulator and in a certain amount of time in Canadian robotic arm simulators. So I would say, again, it's a very universal concept.
Fantastic. With regard to risk management, what do you think that we as anaesthetists can learn from you in space travel about risk management?
Well, one thing is that our paradigm is a little bit differently in that we take basically healthy people, fit people, and we put them into an unhealthy environment. And so our risk-benefit trade is a little bit different. We do that because we think the benefits are worth that risk. But we want to know where those risks are, and we want to quantify them, and we want to close the big risk gaps that we can as much as possible. So if there's anything to take away, one thing I think NASA does quite well is to really identify every single step of a risk ladder and quantify each one and figure out how to close those gaps as much as possible. We, I think, do very good due diligence in identifying and coming up with mitigation steps. If there's multiple solution sets, we try to have all of those ready. When we simulate, we document all of those applications, and then we debrief everything, every simulation, every actual mission, every part of mission training. And again, it's all based around that risk matrix and trying to minimize the large gaps in risk assessment.
So prospectively looking for the risks, thinking about them, simulating them, and then going back and testing to see whether or not the mitigation strategies work?
Absolutely. It's always a matter of what you got right and what you got wrong, and that includes after every sortie and after every program when you've had a composite experience of, say, several missions. So that's very much at the core of our culture is risk assessment, continual risk assessment.
Okay. Well, we've learned a huge amount from the talks that you've been giving here. We've certainly been working you hard over the last few days.
No worries.
I'm interested in what you've learned. If there's anything that you're going to take away from this conference and think about in a little bit more depth.
Well, I always enjoy getting other perspectives on what we do. I've gotten some very good, somewhat provocative questions from folks that see things a little bit differently, and those always help shape your views. There was a tremendous program this morning on the microbiome, and that's something very key to us because we're just starting to scratch the surface of the human and the environmental microbiome in spaceflight, and the idea of having to go to a very sterile place and build one to make the crew as healthy as possible is something we're just considering. So that was terrific. I think Baroness Greenfield's work on mind change akin to climate change is also very enlightening and causes us to think a little bit because we inherently live, I would say, in a very high-tech world, which is very screen intensive. So a lot of provocative thoughts there as well. And just learning new ways to manage pain in the field is something that we may end up having to face at some point. So
that's great.
Yeah.
Well, thank you very much for sharing all of your knowledge and all of your experiences with us,
my
with
pleasure.
us here.
Yeah.
And I hope you enjoy the rest of the conference and the dinner this evening.
All right, thanks
Great.
very much.
Thank you very much.
All right.